Excelsius really has been a revolutionary change in my practice for a number of reasons. As somebody that teaches residents and fellows how to do surgery, I'm now really able to focus on teaching a different type of technique. So, for instance, with minimally invasive surgery, that can be difficult to teach a resident. There's a learning curve that each and every surgeon almost has to go through on their own. With robotics, I can take that procedure and teach it to a resident. So now I've got residents who are learning minimally invasive TLIFs, for instance, minimally invasive percutaneous fixation, whereas before that would be something that you could only learn later in your residency or even only during your fellowship. So I think I'm most excited about where we're going. The premise of being able to put a pedicle screw in, that's great. Doing things percutaneously is fantastic. But I think the future lies in helping us place inner bodies, helping us do bony resection, helping us make osteotomy cuts, and further minimizing the tissue disruption risk of major surgeries.